Hello everyone, and welcome to General Practice Solutions Tuesday Talks. My name is Molly, and I'm joined today by Jenny, who is Head of Workflow Optimization and Clinical Coding at GPS. Today, we'll be discussing the importance of clinical coding support in primary care organisations. I'll hand over to Jenny. Can you tell me, Jenny, what is clinical coding and why is it important?
Hi Molly, thanks so much. So every day, hospitals, A&E departments, mental health services and community providers send vast amounts of information to general practice. Now these include discharge summaries, outpatient clinic notes, specialist reports and care plans. This information is vital for patient care, but it arrives in an unstructured format, so free text letters, PDFs and scans. So for this information to be useful, it needs to be reviewed, coded correctly and added to patient records as soon as possible. Without accurate clinical coding, key diagnoses may be missed, medication changes may not be recorded, and practices may lose out on NHS funding. More importantly, delays in coding can lead to delays in patient care, affecting patient safety and practice efficiency. So what I want to discuss is how General Practice Solutions can help primary care organisations overcome these challenges. We'll look at the impact of poor clinical coding, the benefits of accurate and timely document processing, and how outsourcing this work to General Practice Solutions can reduce workload, improve patient safety, and support financial sustainability.
Thanks for sharing that information with us, Jenny. Can you let us know why clinical coding for incoming documents matters?
Yeah, absolutely. So across primary care, the demand for efficiency has never been higher. With rising patient numbers, workforce shortages and financial pressures, practices and networks must ensure that every part of their workflow is as streamlined as possible. One area that often causes significant strain is the processing and clinical coding of incoming documents from secondary and community care. When hospital discharge letters, outpatient clinic notes or specialist reports are not coded correctly, key details can be lost in the system. So a new diagnosis might be buried in a letter and never recorded in the patient's medical record. Changes in medication may go unnoticed, leading to prescribing errors, and uncoded long-term conditions mean missed opportunities for proactive care and lost QOF and enhanced services income. These errors don't just affect individual practices, they impact the entire primary care system by reducing data accuracy, increasing workload and ultimately compromising patient safety. If it isn't coded, it is as if it never happened, and this is a serious risk for both clinical care and operational efficiency.
So how can General Practice Solutions help support these organisations?
Absolutely. So this is where General Practice Solutions comes in. General Practice Solutions provides an expert clinical coding and document processing service designed specifically for NHS primary care. By outsourcing this workload, primary care organisations can ensure that all relevant diagnoses, medications and care plans are accurately recorded in GP systems, reducing risk, improving efficiency and securing the funding practices are entitled to. When a hospital discharge summary arrives, General Practice Solutions ensures that all new diagnoses are coded, medication changes are updated and any necessary follow-up actions are flagged. For outpatient and specialist reports, they extract and code relevant conditions, ensuring patient records remain accurate and up-to-date. A&E and urgent care summaries are reviewed to track unplanned admissions and emergency visits, helping practices manage high-risk patients more effectively. For mental health and community care documents, General Practice Solutions ensure that care plans and safeguarding concerns are correctly coded, supporting integrated care and early intervention.
That all sounds amazing. So what are the benefits for primary organisations?
So by outsourcing document processing and clinical coding to General Practice Solutions, primary care organisations can reduce the administrative burden on GPs and practice staff, allowing them to focus on patient care rather than paperwork. Now this improves efficiency, eliminates document backlogs and ensures that patient records are accurate and up to date. Better clinical coding ensures that practices capture all of the QOF and enhanced services income that they are entitled to. For PCNs and larger primary care organisations, this means consistent and accurate data across multiple sites, supporting effective population health management, workforce planning and strategic decision making. By ensuring documents are coded correctly at the point of entry, patient safety is improved, GPs and clinical teams can trust that the information on the patient record is complete and accurate, reducing the risk of errors and enabling a more effective proactive care.
So with this, what kind of contracts do General Practice Solutions tie you into?
One of the key advantages with working with General Practice Solutions is that our support is fully flexible and scalable. Primary care organisations can choose the level of support they need, whether it's a one-off backlog clearance, ongoing document processing, or additional capacity during busy periods. There are no long-term contracts, so organisations only pay for the support they require when they need it.
This sounds great. So why should I choose GPS?
Well, unlike general admin support services, General Practice Solutions specialises in NHS primary care clinical coding. Our team understands the complexities of GP workflows, NHS funding requirements and data quality standards, ensuring that coding is done quickly, accurately and in full compliance with NHS guidelines. GPS can begin supporting a practice, PCN or primary care organisation within 48 hours of mobilisation, proving an immediate solution to document backlogs and workflow inefficiencies. So our expertise in working with EMIS and System 1 means practices don't need to worry about training or integration issues. We work remotely onto your existing systems. So effectively, by working with General Practice Solutions, organisations can ensure that every hospital letter, discharge summary and care plan is reviewed, coded and recorded accurately, reducing workload, improving efficiency and ultimately strengthening primary care services. If your organisation is struggling with backlogs, coding accuracy or ongoing document management, General Practice Solutions is here to help, because better coding means better healthcare and a stronger, more efficient primary care system for everyone.
Amazing. Thank you for that information, Jenny.
Thanks very much, Molly.